Hi, I'm Dr. Lamia Gabal, and I'm here today to talk to you a little bit about your upcoming surgery, the suburethral sling with mesh. So the suburethral sling with mesh is a very common surgery that we perform as urologists. It's a very safe and durable treatment for stress incontinence. Stress incontinence is the leaking with movement, that means with coughing, laughing, and sneezing. And the type of mesh that we use is still the gold standard for the treatment of stress urinary incontinence. It is not the bad mesh that's been taken off the market. There's no controversy in regards to the safety or the effectiveness of this little mesh sling that we use as a hammock. And so approximately 2 weeks before your surgery, we'll ask that you have a pre-op appointment with your primary care doctor. And that would be to make sure that you have an EKG and some blood work to ensure that it is safe to give you general anesthesia. For the week before, we ask that you have no blood thinners. That means no aspirin, Motrin, Advil, Aleve. If you have a headache or anything else, Tylenol is the only thing that's okay in that week before. There's nothing to eat or drink after midnight the night before. You'd present to the outpatient pavilion operating room about an hour and a half before the scheduled time. I will see you that morning in the pre-op area, and the anesthesiologist will meet you that morning in the pre-op area. And the whole surgery is done under general anesthesia. You're completely asleep. Your legs are up in stirrups. I go through the vagina, make a small little incision underneath the very top of the vaginal wall, underneath the urethra. And then I pass this tiny little mesh hammock underneath the urethra in two different directions that now acts as a little sling there, so that with coughing, laughing, sneezing, or movement, it stops your leaking, and it's an excellent treatment option. I close that small incision with a stitch that does not need to be removed. It will dissolve. And then 99% of our patients are able to urinate in the recovery room and go home without a catheter. And we ask that for the first 2 weeks after the surgery that you restrict your exercising, just to allow that little hammock to kind of scar into place. And then after 2 weeks, you can go back to normal exercising, but nothing in the vagina, including tampons, penises, fingers, for 6 weeks, because we don't want that little incision to open up. And then what you can expect initially is that the stream, when you're urinating, might be a little bit weaker, because initially your urethra is nice and wide open. You can pee pretty quickly, but that's likely why you're leaking. When we put the hammock, it does change the way that you urinate. You'll notice that. But you'll also notice that with coughing, laughing, and sneezing, you won't have the leaking. And you will also, there's a small risk of possible urinary tract infection, possible retention of urine, but these are very rare. And also there's a chance for recurrence. We do usually expect the sling to last for 10 to 15 years, but it's very dependent on each patient. If I have someone who is a professional bodybuilder or a UPS driver, who lifts hundreds of pounds on a daily basis, they may be more at risk for early recurrence. Also, obesity or smoking and a chronic cough puts you at risk for earlier recurrence. But overall, it's an excellent treatment option, minimally invasive, long-lasting, very minimal side effects and risks, and very minimal downtime. So hopefully, if this is something that you're considering, this helps to guide you a little bit for what to expect for the preparation and the recovery for this treatment. Thank you.